Hi, it's Kendrick at worldmedicalschool.org. We're going to talk about autism, etc., which is the autism spectrum disorders. These are also called the pervasive developmental disorders, and altogether they affect about 1% of the population, more so in boys than girls, and autism is the most common of all these. So, autism, Asperger's, Rett's disorder, childhood disintegrative disorder, and then pervasive developmental disorders not otherwise specified. You'll see this NOS abbreviation quite a bit in psychiatry because there's a lot of disorders that don't quite fit the mold of psychiatric disorder, and so you say not otherwise specified to kind of say it's like these disorders, but it doesn't quite fit into one of the categories we've already got. So these kids will have symptoms before the age of 3, but a lot of times they don't get picked up right away because in these younger ages, it's still in the spectrum of normal. The major symptoms are impaired social interaction or communication. A lot of the times these kids don't smile very much. They don't make eye contact. They don't show a lot of interest in relationships. And I put lack of interest here, but they have interests. They just are generally interested in different things than what the rest of us are interested in. And so sometimes that will be just fixating on one particular object or just a piece of an object. I've got a picture here of a kid laying down next to his toys that he's aligned perfectly in a row. Now this is something that my little boy did all the time. He doesn't have autism, but it is kind of an early sign, just this attention to detail and order. And a lot of people with autism are starting to say, maybe this isn't so much of an impairment, but just a difference, that they have this attention to detail and their brain works a little bit differently, and it's not necessarily a bad thing. That's an idea that's being proposed by adults who identify with autism or Asperger's, but I think in general most parents are still kind of viewing it as a disease that needs to be cured. So add on this list of the presentation stereotype speech or movement. A lot of times they'll repeat things or do the same movement or activity over and over again. One example would be stacking cans over and over and over again. Delayed or absent speech is a key feature of autism. Sometimes you will have an autistic child that is 10, 14, or even an adult that doesn't speak or has very limited speech. And then there's some cognitive impairment involved that sometimes it's hard to put any specifics on just because the lack of speech. So, and then the term Asperger's usually is just considered autism without the speech or cognitive impairment. So these people can often function really well in school. They do well even up through college, but they just don't do well socially because they have some of these aspects listed above. They're not as interested in relationships. They're often described as lacking empathy. They just don't really feel what other people feel, and a lot of times they have a hard time communicating, so they don't have a lot of friends, but they can still function in jobs and in school. Rett's disorder is found in females, and it's progressive impairment after 5 months of normal development. So this can happen at a fairly early age, or it can happen, when they're a little bit older as well. 2 or 3, you can have this progressive impairment and it's going to look a little bit like the next one that we'll talk about, except for it's got impaired head growth, which is kind of different. And the big difference here is that it's a genetic disorder, and therefore it doesn't fit as well into the psychiatric disorders. And there's talk about taking it out of DSM-5. Childhood disintegrative disorder can look a little bit like Rhett's, appears both in males and females though, and it has severe regression after the age of 2 years. And so a difference here that would be that you don't have the head size difference, but language, motor skills, social skills, and some of these kids who have been potty trained will start wetting the bed, start losing control of their bowels, and they might lose interest in some of the games that they used to play. So treatment for this spectrum of diseases is mostly focused on special education and management of behavior. Like I mentioned earlier, a lot of the autistic community are starting to identify themselves as a different but not impaired community of people, and therefore some of the shift has some of the treatment has shifted over to basically just fitting into society or finding a place in society, as opposed to changing the way the brain works. And some support groups like wrongplanet.net and a lot of other online resources are available and very helpful to these people who are used to being very different. So if they can have the support of people who are like them, that can be really helpful for them. And family counseling is important because it takes a lot of it takes a toll on families to have a child that is autistic. You can treat with some drugs for some particular behaviors, like SSRIs for the stereotype behavior and neuroleptics for aggression. But in general, the main management is education and support. To volunteer, please go to worldmedicalschool.org/volunteer. There's a lot of things that we could use help with, including preparing these presentations, managing the website. We need some help with design and a lot of help with editing. But if you have a moment right now, just leave a comment on the video if there's anything that you saw that should have been included and wasn't, and anything that was incorrect on the video. Thanks.